lower self-belief,
lack of resources,
illness,
exhaustion,
pressure, workload,
loss of patience,
bureaucracy,
lack of autonomy,
demoralization,
task management,
skill gap.
It is important to understand that the healthcare system is a system with an extremely lack of resources at its core. The main effect of lacking of resources is on our workforce. This creates a gap between what they thought was going to be their job as a caregiver and what it is actually.
We've had a 40% turnover in nursing over the past 6 months to a year. And we are expecting a nursing shortage in the next 3 to 5 years. So we're talking about a significant impact to nursing. They're just truly worn out and frustrated. ICU nurses especially have lost so many patients. With that, as nurses have exited bedside nursing because of the stress of that, they have other stressors at home that are contributing. They have their kids at home, so they're homeschooling. They have other stressors. They have illness that's hitting them. Many of them got COVID as well, despite vaccinations and protection in the health system, which is done very robustly. We're still out in the community. And the nursing shortage that has significantly impacted us. Nurse-patient ratios have increased because there just isn't anybody to work. We also are talking about now is we always had PTSD, post-traumatic stress syndrome, in nursing, but it has exploded in the past 2 years because we've added so many other stressors. And then violence in our workplace. We hear all the time about the drunk on the plane who got violent. Our nurses are impacted by this almost every day, where patients and families with mental illness or they're under stress are acting out against our nurses, our physicians, our techs, our nurse aides. They are seeing probably double the violence that they might have experienced in the past.
Israel is considered one of the leading countries in quality of healthcare services and health indicators. The strength of the health system in Israel, based on the top-level professionals who operate in a well-organized public system. At the same time, the challenge comes from limited resources and ambition to be at the forefront of technology and medical innovation, with all the complexity of excellent patient care. This creates heavy operational loads, pressure, and burnout within healthcare teams. This tension exists in healthcare systems all over the world. To address this challenge, the Israeli Ministry of Health launched the National Program for Preventing Burnout in 2016. The national program is designed to raise awareness within the healthcare system and among the general public to the challenges that healthcare workers face in the work routine. Established to mobilize the entire system to invest resources in two ways: organizational and personal. Organizationally, to promote culture that takes into consideration the impacts of all aspects of work environment on employee workloads and experiences. And personally, to take care of employees by offering them personal wellness strategies to successfully manage stress and workload, as well as closer monitoring of their health.
We know now that healthcare organizations, even before COVID, experience burnout, and both medical staff and surrounding supporting and administrative staff. There are several factors that contribute to burnout, including intense patient care, administrations, task load, and challenging patients. In addition, COVID caused adding additional tasks to our day-to-day activities, great deal of responsibility in terms of digitization, contact with patients, think outside the box to produce an optimal tailored solutions for patients during the pandemic. And of course, the private life mixing with the professional life, that's for all of us.
At a system level, we found stressors like workload, lack of support for personal difficulties, overload of administrative tasks, bureaucracy, and lack of coordination between officials. Looking at the resilience factors, we need to address the organization commitment to employee health, a sense of safety, and work-life balance. There are all problems that can be addressed by technology and innovation.
It is clear that the workload is going to balance among man and machine, but we don't see significant integration in the healthcare system. The technology will perform tasks that would save doctor or nurse time and can enable them to be more focused on their patient-physician interaction. An example of this would be measuring metrics using wearable items. Today, the teams have a lot of forms to fill, whether on paper or the computer. It takes a lot of time, so we think technology can do a lot of things in this challenge.
We found that stress related to organisational processes, so for example, poor management and poor levels of supervision, were associated with higher levels of burnout as well. Lower levels of job autonomy contribute to burnout more frequently, so that means you feel like you've got less control over what you're doing on a day-to-day basis. And a lower self-belief, so the belief that you can do it, also contributes to that level of burnout, particularly exhaustion. So that emotional exhaustion element of burnout, and work-family conflict. So if you felt like work was more important, or you were being forced to work hours longer than you would normally like to, it was negatively affecting your family life, that's also associated with increased exhaustion. So, that work-life balance is really, really important.
Our frontline workers work very hard in strenuous conditions, and most of their day-to-day work is scheduled from above. The patient contact is scheduled as one size fits all, every patient, and it doesn't matter if they're more complex or have less problematic issues, receives the same amount of time. And the experience of the frontline workers is that they have minimal control over their day-to-day work. Lack of control and the inability to provide tailored patient care creates a lot of the burnout that our workers feel, and some of the more injury where they experience a significant difference between what they think or the quality of care they can provide with the quality of the care they are providing due to the processes that control their time.
A system-wide survey is conducted among 70 organizations across the entire healthcare system, including hospital, healthcare providers, and mental health and geriatric institutions, representing a total of 160,000 employees. This survey maps burnout by profession, field, and organization. Each health organization received a report detailing levels of burnout among different groups and the specific factors of each group. The findings are presented in comparison to the previous survey and to the average similar organization. The purpose of the segmentation is also to identify high burnout professionals or area, and also help understand which factors have the greatest influence on burnout.
The information is in files, and it takes a lot of time for a physician or any other caregiver to search for it, and not in the intuitive search like we all used to on Google, for example, with keywords or key letters. They have to go through every file, not knowing if they even have the information on this patient's file. Task management with integration to various systems. Sometimes a patient can go through one section in the hospital to another, and then he has a lot of tasks that the physician needs to do in order to continue his treatment, and it could be any other task. Today, the physicians don't have task management like we see in a lot of high-tech companies. And the basic needs like pillows, blankets, and food is something we always need to remember is the base of every challenge that we have. So maybe it's not that intuitive to say that technology can assist here, but we think even a vending machine with pillows and blankets can help a lot.
We just do not have enough behavioral health resources in our country. Fortunately, our behavioral health professionals have gotten really into using technology and video to expand their access, but it's not enough. And often our nurses don't trust our employee assisted programs. Despite how much you tell them that it is confidential, they don't feel safe using them. So those are just some of the things we're experiencing here.
The market is changing. The skills and abilities of employees are no longer matching the job requirements. That means that the day-to-day requiring a great deal of effort, management, and control. The process of career development promotes resilience, this much we know. having the ability to go through a development process in the organization in terms of promotion, in terms of mobility, in terms of integration of experience, and in aspects of learning and development is a supporting factor that strengthens connection and belonging. We call our program Better Next, and we're taking a big step forward in career development, providing employees with diverse opportunities to shape the direction of their career.